the Wet Dreams podcast. I'm your co-host, Jose Gonzalez, and I've been here at the Hinman Counseling Center for a few years. I'm also a sex therapist, and I've, through the program at University of Michigan School of Social Work, and I primarily see guys with out-of-control sexual behavior.
Hi, I'm Dr. Brad Hinman. I am a licensed professional counselor. I am a licensed marriage and family therapist, and I'm also a certified sex therapist. I did my sex therapy training also through the University of Michigan Sexual Health Certificate Program. And I also specialize in working with men with out-of-control sexual behavior. So that can be like pornography addiction, massage parlors, random casual sexual hookups, affairs, flirting online, all those types of things. So that's what I do.
Sweet. So I bet you were wondering why we called this podcast Wet Dreams Podcast.
I am wondering that.
So it's a two-part thing. So the first one, there's this song from this rapper. His name is J. Cole. I mean, the song is the same name, Wet Dreams with a Z.
Oh.
So the song talks about how he has a crush on someone, and then they're planning on getting together and having sex or whatever. And she asked, "Oh, have you ever had sex before?" And then his response is like, he knows he hasn't. He says he's a virgin, but then his response is like, "Yeah, I'm a pro. I'm a pro at sex. Like, of course, you know." So they go around. He watches porn to like practice, and he like practice putting condom on. And then it turns out that at the end, when they're having sex, the girl also hasn't had sex and she's a virgin, so it ends up in that way, you know.
Yeah.
But there's this idea of like, as guys, like we have to like know what to do. We have to like be pros, and we have to last long, and we have to have big penises and all this stuff. So I think like that really sparked the idea of, you know, doing this podcast and like telling the guys that listen to us, like you don't have to know everything, you know. You don't have to fake it necessarily. Like, it's okay not to know things. And in the process, we'll teach them things, and then they'll actually know, you know. Mm-hmm. So that's kind of where the Wet Dreams podcast kind of came from. And also, you also had an experience, I think, with Wet Dreams where you had a presentation. I don't know if you want to talk about that a little bit.
Yeah. So I was doing a presentation, and it was at a religious organization. They had invited me in, and so after the presentation, I had one of the attendees came up to me, young male, and he was really troubled, and so I was asking him what was going on, like why was he troubled? And he talked to me about, he felt that when he would sleep at night and he'd have a wet dream, that he was sinning because he was dreaming about sex, and he wasn't allowed to have sex because he's not married. And so he was really worried, and so I had to have this whole conversation with him about that, you know, men are constantly making sperm cells, and they only live for 2 to 3 days, and then your body has to expel those, the dead ones. And so, you know, I explained the whole biological process to him, and that it really it's really, to me, like urinating or defecating. Like it's expelling waste. Mm-hmm. That's all it is. And so he felt better, I think, after that. I'm not sure that he was completely healed of that, but he did feel better after having that conversation with me, that it wasn't a sin. You know, I said, even if you are dreaming about sex, you're not responsible for your dreams. Like, that's not, dreams are by definition out of our control. Like, we can't control, there are some people who can control their dreams, but the vast majority of people cannot. And so we're not held responsible for what we dream. I don't feel. I'm not a theologian. I'm not a theological expert. I'm not a sin expert. But that's my professional opinion.
Yeah. Well, and imagine how long he was going thinking that was a sin, like something that his body is doing, or something that, you know, had he asked that question before in the past, and he's just thinking like, oh, I'm going to hell, for something that my body's doing. Like, it's crazy.
Well, and that brings up a good point that, I think we need to provide opportunities for people to ask questions, because there's not a lot of opportunity in Midwest American society, and I think this is a worldwide problem, for people to ask questions about sex like that. Like, who's he going to ask? His parents who have probably never talked to him about sex ever in their entire life. Is he going to go and ask them? Or is he going to ask his friends who probably also have wet dreams and who probably are going to make him feel like a freak, even though they're doing the same thing? Like who, and so I'm glad that he felt comfortable to ask me that question. I told him when he asked me, I said that you're really brave for being able to articulate that question to me, a perfect stranger. But because I was already talking about sex to him, I made myself available to him to ask that question. And I think we could do a better job about that in society, is giving people opportunities to ask questions about sex without judgment, really. And I would encourage parents of young children to make themselves available to answer their children's questions without freaking out and without judgment. Just answer the question factually, keep it short and sweet, but just answer. Because if you don't answer their questions, they're going to get those answers from porn, and from their friends or their friends' older brothers, and it's probably not going to be accurate information.
Yeah. I mean, and I think that's why, that's part of, again, a reason why we started this podcast, to give people an arena to ask questions as we go and as we do more podcasts. Like, we want to hear questions about sex or your body or whatever, where hopefully we can answer them in this podcast or in some way, having that space for people to talk and to ask those questions.
Because it is something like you mentioned in your intro, like that, especially for men, we're supposed to know everything about sex, but have never had any conversations about it. We've never asked anybody any questions about it. We're just supposed to be, boom, that knowledge is all there. We are an encyclopedia of sex now, right? All of a sudden. And so, how do we expect people to be knowledgeable about this if they can't do it, because we're taught for 25 years to never have sex, and then we don't ask questions and we don't get our questions answered? So it's a miracle anybody knows how to have sex.
Exactly. Right. Yeah, for sure. And another thing that's coming to mind too, and it goes to the title of this episode, Grab Your Balls or Going Bowling. Yeah. Now, I'll get into the story in a second, but another idea that I'm thinking about is humor, and how guys, it makes me think about being in a locker room and like talking about your conquests and the conquerors, even if whether or not you actually had sex with that person or not, or just like that scenario with the wet dreams. Had he asked a friend of his, maybe the friend would have made fun of him, like, what are you talking about, wet dreams? That's dumb, what I mean? There's this idea of like humor as a cover up, especially with guys. I mean, that's the people we're talking to is guys our age and stuff. And that humor. I don't know if you want to say more about that, but
well, I do think that humor is a way to kind of alleviate some of that stress, some of the anxiety around topics like this, and it kind of just is disarming, right? For like, if we can laugh about our own foibles, right? Like our own faux pas, right? Like it's a way for people to just be kind of disarmed and open. And then, so if we combine the humor with the knowledge, right, like with the teaching thing, it makes teaching less boring, right? For both the recipient and for the teacher, if we use humor in that. And also it engages more of your senses. It activates more areas of your brain, but I won't put you to sleep with talking about the brain.
Well, in talking about humor, I'll tell you my story then. So I, back when I was doing my undergrad, I had to, it was my master's. we had like our ID for our undergrad where we took a picture ID. So I had to retake my picture ID for my master's. And I don't know where I got this shirt. Maybe my sister as a joke or something. I had a shirt. It said, "Grab your balls, we're going bowling."
Oh.
And it was a guy bowling, and I'm assuming it was purposefully like punny, you know. So I put that shirt on for some reason that day. Went to take my picture for my ID, and when they printed it, I looked at the shot, and all you could see was "grab your balls." So that cut off half of my shirt, and I'm here with like this like cheesy smile, like where my shirt saying "grab your balls." You know. So I ended up having that ID maybe like 3 years, a "grab your balls" shirt. You know what I mean? So it just reminded me again, like that's goes back to the humor thing, like "grab your balls," you know, or like stuff like that. Like it's just so funny.
It is funny.
Yeah, definitely. So what do you think? What do you think are some things that guys think about their bodies that are, you know, that are it's not helpful, or some of the myths maybe, I guess, like about bodies and body image and. You know, I mean, one thing I'm thinking about is like penis size. Like, I feel like that's like a really big one.
Mm-hmm. Well, I think that like so many of us have this image of perfection, whatever that means, right? That we want the perfect body, we want the perfect penis, we want to be able to use those things perfectly, right? That we have to be perfect. There's a lot of pressure for perfection, even internally and externally in society. Like even on social media, right? You might go to the park one day and you're going to take 100 pictures, but you're only going to post one, right? The perfect one, where you're in the right position and you're in the right smile and you're looking in the right direction and all those kinds of things. So I think social media perpetuates that perfectionistic tendency that we have. I think all men want the biggest penis and the hardest penis, and that it never goes soft when we don't want it to be soft, but it's never hard when we don't want it to be hard either, right?
Right.
Like when we're riding on the bus or something, and so that, and obviously we're supposed to know how to use it, and we're supposed to be perfect at using it with whatever partner we have, or even by ourselves. And so there's just this push for perfectionism, and then if we make a mistake, right? If our penis isn't hard when we want it to be hard, then now we're awful and we're worthless and we're horrible and nothing's ever going to go right, and we're just worthless, and I'm never going to find a partner, and nobody's ever going to love me because this one thing is not perfect every single time. When really in humanity, nothing is perfect ever. Like we're just, I think we're designed that way, right? That that things are not perfect. Like even shoe salesmen will tell you one of your feet is larger than the other one. It's like things that are supposed to be the same are never the same in humans, and so there's just a lot of destructive thought processes around this, our bodies and body image. And of course, like, we're supposed to be thin and we're supposed to be muscular and we're supposed to be, but not too thin. Like guys are supposed to be thin, but not too thin, right? We're supposed to have muscles, and those muscles are supposed to be visible. Of course, now dad bods is kind of a thing,
right?
But even then, it's not too dad body,
right?
Because that's not sexy,
exactly,
right? Which leads me into a whole nother thought of what is sexy, right? Like, people my age, I'm reaching the age now where I'm not sexy, that's that, like, I'm not supposed to be having sex. I'm not supposed to be doing anything sexy, right? Because I'm too old. Or, people that are too young, they're not supposed to be sexy.
Right.
But we kind of veer towards that, like clothing sales, anyway, that's a whole nother topic.
Yep. But it highlights to me, like, the big thing that's coming out is, again, that that idea of feeling bad for something that you can't control.
Yeah.
Like, for example, like erections, like half the time you can't control your half the time. To quote Emily Nagoski, I think it's 50% of the time
Mm-hmm.
you're not aroused. So you have an erection that means nothing, essentially, in the sense of like arousal and being turned on. Half the time it's not, you know. Or like again, the wet dreams, you didn't control that.
Mm-hmm.
Or your penis size, clear for sure you didn't control that. That's something you were born with. You know,
Right,
like
right.
all these things, feeling bad and having shame, feeling bad about ourselves because of things that we can't control. You know, I think that's ridiculous. You know?
Right. Yeah, and then when we obsess about things that we cannot control that are not perfect, then we neglect the things that we can
Mhm.
control that we should be thinking about, like building our relationship or being nice to ourselves and
Mhm.
talking nice to ourselves. Right.
Mhm.
Those are things that we
Right.
can control, but we ignore those things and we talk horribly to ourselves and we talk horribly to our partner. And so, but like I said, we can control those things, but we end up hyper focusing on stuff that we can't,
Right.
that we don't have any control
Right.
over.
Or finding our own pleasure. That's something you can control despite what your body looks like.
Right.
You know what I mean?
Exactly.
Yeah, definitely. So yeah, I don't necessarily know where to go from here. So I'll start again. Hold on, after you. So what are some things you hear from clients or people or whatever? What are some things you hear that they're struggling with as far as like their body? Like it could be some of the things we've already talked about, but from clients.
Sometimes it's the image of it. Like
Mm-hmm.
I had a client one time. He had a blemish on his penis, and he for real thought that no one was ever going to want to be with him. And it actually was a very, I mean, I never saw it, but it was a very small blemish from his description. And it was actually on the underside. And I'm like, well, nobody's really going to be looking at it, you know, like, but I just think that people, so it can be how it looks, it can be how they use it. It just a lot of I've heard a lot from clients like I'm too fat or I'm too skinny or I'm not muscular enough or I've heard even I'm too tall, I'm too short, right?
Mm-hmm.
like there's lots of, and all those things you cannot control, right? Those are all the result of genetics and biology and all those kinds of things like that. And so, you know, we have what we have, and we need to learn how to use what we have in a healthy way. But, you know, just a lot of another thing similar to that I hear from clients is I should be, you know, they're using the word should, right? I should be married by now, or I should have children by now, or I should be in a relationship by now, and I'm not, right? And so they hurt themselves and punish themselves because they're not who or what they think they should be. And to me, like if you're not in the place where you think that you should be, then do something about that, right? Like make a plan, make a goal, make short and medium and long range goals to change your life, the things that you can change. But we often don't do anything to change it. We just complain and get mad at ourselves for not being the way we want to be.
Yeah. Well, and I think it's also, again, specifically to the guys, you know, we're not given an opportunity, I think, often to realistically look at those things or realistically look at our feelings on our body image or just feelings in general, I think. You know what I mean? Like, we don't know how. I think that's what it comes down to. I mean, growing up, we didn't really talk much about, I mean, other than feeling of anger, for example, that's socially acceptable for a guy to be angry or a guy to be horny, I suppose. Like, other than those things, like, that's okay for you to feel as a guy. other than that, we didn't talk about sadness. We didn't talk about hurt, you know, in a serious way. We didn't talk about happiness and joy, I guess, or maybe to some degree. But those negative feelings as guys, that's not something we talked about. Whether it's was my upbringing, my family, or was it with my friends, or people around me. That just wasn't a thing in the same way I think that it might have been for females stereotypically. But
no, you're right on with that. With my experience of working with men, men are not acculturated to talk about their feelings. They're not acculturated to even feel their feelings, recognize those feelings. Like you said, we can be angry. That's the one feeling men are allowed to have. And whenever I talk about this, I always joke that like we can be happy, but it has to be around sports, and we have to look like we're mad. Yes, you know, we have to appear angry even when we're happy, and so, but we can't be too angry because then we have to go to anger management classes, right? And so, but other emotions, like you said, like sadness, frustration, hurt, you know, having our feelings hurt. It is really, really difficult for men to say, you hurt my feelings. At first it's difficult for them to recognize that their feelings are hurt, and then it's really hard for them to express that their feelings were hurt. We feel that like we have to express anger when our feelings are hurt. And I'll tell people, you look like you're angry, but I don't think you're angry, I think you're hurt. So say that, right? But that's way too vulnerable for men to say, you know, when you called me a name or when you looked at me funny, you hurt my feelings. Like we can't say that. We have to get mad and call them a name, like, you know, and to express our hurt, which is so backwards.
Yeah.
And then I always tell people like when you ask a man for a feeling, they give you a fact, right? Well, how did you feel when, you know, your wife cheated on you? Well, it was a Tuesday. And I'm like, that's not a feeling. And so, but it's because we don't, from birth, we do not raise boys to talk about their feelings, to feel their feelings, to express their feelings in healthy ways. But if they get angry, then that's okay. Because then we say things like boys will be boys, and we just kind of let them do their thing.
Yeah. But it is an interesting, like, the thought that came to my mind was like, you know, being hurt, for some reason it means like you let the person hurt you, you know, and I think as a guy, it's almost, I mean, you're like blaming the victim in some ways. Like, how did you let that person like get in to where they can hurt you? You know what I mean? And you as a guy aren't supposed to let people do that, or you're not, you know, like they did something to you, like, but you're the one to blame. You know, it's just such an interesting like phenomenon.
Yes, you let them hurt you because you're weak.
Mm-hmm.
Right?
Exactly.
The implication there is that if somebody hurt me, then I'm weak. And no, it means you're human. It means you have feelings, right?
Mm-hmm.
Like you're supposed to have feelings. And so, in that, you know, if we talk about relationships, you know, if it's a heterosexual relationship with male-female, the female has been acculturated way more to talk and process and feel her feelings. So we call it emotionally intelligent, right? So the female is way more emotionally intelligent than the male is, because the male has zero experience talking about and processing feelings. And then now he gets in a relationship with a female who is all about talking about and processing her feelings. And then she turns to the male and says, why don't you ever tell me how you feel? Well, it's because they have no words, right? They have no they have no template to be able to talk about how they feel, because they've been taught for 25 years to not talk about how they feel. And so, you know, I think it just leads into problems, right? Because now you're mismatched, because you have somebody that's very versed in talking about feelings and somebody that's not. And I think with, you know, because we both deal with men with out of control sexual behavior, and, you know, I think that any addiction is a coping mechanism for feelings, right? And so when we can't process and talk about and feel our feelings, then we find a way to cover them up and numb them and move away from them. And whether that's heroin or whether it's cocaine or whether it's gambling or whether it's sex or whether it's porn or whether it's alcohol or drugs or whatever, like we're doing that to numb those feelings because we don't know what to do with them. So we just want them to go away.
Right. Yeah. I mean, and we have no one to go to. Again, and it's that idea of being weak, that telling someone that you're struggling with, or telling someone that you're feeling, whether it's your partner or whether it's a friend or whatever, I think that can feel like weakness as well, so I'd just rather not even try to do something that's going to make me feel weak. I'm just going to do this thing, this unhealthy coping skill or whatever. Again, I think that idea of weakness for guys, man, I don't think you have to be like a manly man, like, like stereotypical, like you're weak. But I think it's just men in general in our society, in our culture, there's that concept of like those things are weak, and you can't and you shouldn't do them.
Yeah, I think that whole concept of what is weak, I think we need to redefine that too, right? Like, is feeling your emotions and talking about your emotions and asking somebody not to continue hurting your feelings, is that weak? I think that's brave. Like, I think that's strong. I think that's a strong person that's able to do that. So I think we need to change our definition of what is weak, but also we need to accept that we can't do everything, right? So if I'm weak, I'm weak, right? Like, that's fine. Right? Like, there's jars and stuff that I can't open, so I hand it to my son and have him open it. That's fine. Like, I don't care. Like, that doesn't make me less of a man, right? And so, yeah, I think we need to change our definition of what's weak, but I also think we need to embrace more of our foibles, right, and our weaknesses, and accept that we can't be perfect at everything. So.
Yeah. So going back, I think part of some of the myths that we talked about were like body image and how big our penis needs to be, how long should we last, which, by the way, side note, I was thinking about this earlier. The average penis size, I think the fact, and you know what I'm talking about. The average U.S. penis size of average men versus the average porn penis size. Can you tell me about what the difference is?
Yeah, it's
real quick.
It's more than 2 inches difference. The average penis size of non-industry people, men, is about 6.25 inches erect, and the average penis size in porn for men is over 8 inches. And so that, but also for females, like there's unrealistic body images in porn for females as well, right? That porn is just a horrible teacher overall. I'm not necessarily talking about the moral or ethical ramifications of porn. I'm just saying it's a horrible teacher. Like, it's
and people in the porn industry will say that as well.
Yes.
I've seen videos at least.
Yeah, it's for entertainment.
Like, it's not for education.
Yeah, they don't intend it to be for education. It's kind of like learning how to drive a car by watching Star Wars. Like, it's like entertainment. It's not designed to teach you anything.
Or right? Fast and Furious or something.
Yeah. I was trying to think of some ridiculous example. But that's what they watch porn to learn how to have sex or to learn what they're supposed to be doing and what makes people feel good. And that's just not what it's for. It's not realistic. It's for entertainment. So everything is exaggerated, right? But then it makes your partner, like, viewing porn to learn how to have sex, it makes your partner feel inferior because their body doesn't look like that. And it makes you feel inferior because your body doesn't look like that, right? And they don't, the porn industry doesn't show what all goes into people to be able to function in the porn industry, right? And so, but it also doesn't show all the times that the man lost his erection during an 8-hour filming episode. And it doesn't show all the times that, you know, the female experienced pain upon penetration. You know, they only show the acting part of it, right? And so, yeah, like you said earlier, penis size, we really have no control over that whatsoever. And so, you know, we got to deal with what we have, right? And so, there's that saying, you know, it's what is it? It's not the size of the ship that matters, it's the motion of the ocean. Right? And so, you know, it's not the size of the tool, it's how you use it, right? And so, and actually, from research tells us that many women in heterosexual relationships, bigger is not always better. Bigger can cause more pain, right? And so, so that can lead to its own problems, right? And so, the human body just varies greatly. There's huge variation with, you know, the size of everything, right? The size of people's ears, the size of their nose, the size of their feet, how tall your torso is versus how tall your legs are. There's just tons of variation in human bodies. And to be obsessive about something that you have no control over doesn't do you any good, and actually it does damage. So,
and you brought up a perfect point, which I was going to transition. The idea of not the size of the tool is how you use it, or so I think on the one hand, I've encountered people that it's like the size of the tool or whatever, that part of it, like the body image thing and the how long I should last, how big I am. But then I think one client that comes to mind is like people not understanding the function of things. So the client that I'm thinking about was putting things in his urethra. I think they would call it sounding is the specific term, and there's sexual pleasure to be found out of that, and there's guidelines to follow in order to do it safely. But he was putting different objects into his urethra, and his thought was that's going to make him ejaculate further. Like he wanted to ejaculate across the room, quote unquote, like in porn, you know. And part of that conversation was like, okay, that's not how that works.
Right.
You know, putting things in your urethra is not going to cause you to have a farther ejaculation. You know, so I think there's those misconceptions too of like what our body does. You know, yeah, I'm not sure if you've encountered that kind of client specific, not necessarily the urethra thing, but as far as their functioning, you know.
Yes, I have.
Yeah.
And actually, you know, having more control over your ejaculations or more control over your body, actually pelvic floor muscle, you know, developing and exercising those pelvic floor muscles can do far more for helping your friend ejaculate across the room rather than inserting things in your urethra. And you're right, that is a thing that some people do for sexual enjoyment, but there are guidelines to do it safely because it can cause, you know, urinary tract infections, and you can tear that tissue because it's not designed to have stuff inserted. Like it's not what that tube is for. And so, you know, there's lots of bad things that can result from that. So you have to be careful when you're doing that. But also, I think it's ineffective for what his goal is. He may gain some pleasure from doing that, but I don't think it's going to help him ejaculate farther. But again, like I would question, why is ejaculating farther better?
Right.
Like, who gets to decide that? Right? And if you're getting that from the porn industry, they're a poor teacher, right? So, I can tell you, I've never had any female or male partners of men say, "I wish that my partner would ejaculate further."
Right.
Like, I've never heard that as a sex therapist.
Right.
So.
Right.
He might want to reconsider what he thinks his goal is, but
yeah, for sure.
Yeah.
Yeah. Right. So it's part of it is again it goes back to being able to have those conversations. I mean, with a sex therapist, obviously in this case, preferable. But even when when the client came to me, he initially brought it up to another therapist, and they were like, "Okay, let's send him to the sex therapist." They weren't comfortable, which is fine. I mean, I'm not judging anyone. Um, but so often people have experiences where they they get the nerves to share something, and then they're met with like judgment. It makes me think of, I think you had a client. It makes me think of younger clients like my age in the 30s that have not premature ejaculation, but not they have erection issues, and then bringing that to their provider or their medical provider and being like, no, you don't. What are you talking about? You don't have issues with your erection. Like, you're 35. Like,
yeah.
So getting that response, like, okay, I've taken, I've pushed through my anxiety and my fear of how this interaction is gonna go, but then my doctor's being like, oh, what are you talking about? Minimizing. And I know that's within the functioning conversation, it's like goes back to having a safe space again.
Mm-hmm. Yeah, I've had more than one client that went to their doctor to talk to them first about their sexual issues, and the doctor dismissed them as, you're too young to have this problem, right? And so, I think that, and so sometimes when I'll have conversations with my clients, I'll say, when you go to your doctor, tell them this. And I'll give them the exact words to use, because like with anything else, the doctor is scanning the words that you're using and applying treatment to these words. And if you don't use the right words, they're not going to be applying the right treatment for it. And so, yeah, I think seeking out a sex therapist to talk to you specifically about sexual issues is important, because in counselor training programs, sex is not a typical class that is taken, right? Like, sex therapy is not a typical class that most therapists take. And so then therapists are hesitant to talk to their clients about sexual issues because they haven't been trained in how to do that. Some therapists are, but the typical counselor training programs do not have sex therapy as a component of that class. And so when we're not comfortable talking about a topic, the therapist will simply steer the conversation away from that topic, right? And sex is such a large part of who most humans are that they need to have a safe place to be able to talk about that and get their questions answered. And that's really what a sex therapist is for. Because my clients know that they can ask me anything, and I'm not going to judge them, I'm not going to laugh at them, I'm not going to ridicule them. I may correct them and say, that's not what that's for, or that's not how you go about reaching that goal. But I'm not going to do that in a denigrating way that insults their intelligence about their own body. I tell my clients all the time, you're the expert in you. You know you better than I know you. But,
yeah. So as we're getting close to the end, I thought we can talk about what would be something you would tell someone, again, our listeners, the guys our age, what's something that they can do as they start to their journey of getting better, from whether that's body image things, something about their body's functioning, or about talking about, maybe having an issue with porn or something like that. What do you think you would say to them as maybe a beginning step?
Yeah, I think that's a good question. I think that, just asking yourself first, is this really a problem? Is whatever this thing is that you think is a problem, is it really a problem? Right? And then if it is a problem, then ask yourself, what can I do about that right now? Right? Because I think a lot of times we see something as a problem, and then we think that it needs to be solved perfectly right now. Boom. But a lot of things are a process, right? So what can I do right now? What is the next right step for me to take if this is really a problem for me? And so kind of set up a timeline for yourself, right? By this time I want to be able to do this, and by this time I want to be able to do that. So like, I guess, first ask yourself, is this really a problem? Is this really something that I should change, or that I need to change, or that I can change? And if it is a problem and it is something you can change, then make up a series, like a plan, right? What can I do now? What should I be doing tomorrow? What should I be doing a year from now? Because I think a lot of times we get stuck when we see something we don't like about ourselves. We just end up complaining about that and not doing anything about it.
Mm-hmm. Definitely. Yeah, and I would say, going along with that, I think it's important to find a trusted person. I think at least a lot of the clients we see, I mean, that's part of the first steps of finding someone that you're accountable to, or finding someone that you can talk to about these sexual topics or whatever. And chances are, if you bring it up to someone that you trust, another male, chances are they've either dealt with it, or they know someone has dealt with it, or has been close to dealing with it. Like, chances are they're gonna relate. You know what I mean? So I think there's a little bit of risk in that, but it's so important to find those people that you can relate to, or you can, whether that's online, subreddit on Reddit, subreddit on Reddit, or forum, or another married person, or whatever, another married person with small children. I know that can be an issue with sex when you have small children, whatever. I think that's a huge first step, and taking a bit of a risk, because like I said, that chances are they're also dealing with it, or they can at least relate to you, and they're not going to judge you, especially if they're a trusted person,
Yeah.
I feel like that's a huge step as well.
Yeah, I think asking yourself the question, like, is my life worse if I keep this a secret and don't ask anybody and don't get any help for this? Is that worse than the pain of asking somebody and being vulnerable, right? Because it's hard for people to be vulnerable. It's hard for men to be vulnerable, but it's hard for men to ask for help, right? But is it worse to continue having this problem, or is it worse to ask for help, right? And like you said, many times if we ask somebody for help, that person may also be struggling with that same thing. Because problems that people have, we think that we're the only one that has this problem. We're the only person out of the 7 billion people on the planet that has this problem. And that's probably not true. Right? There's probably, we're not quite as unique as we'd like to think we are.
Exactly. Yeah. Cool. Awesome. Is there anything else you wanted to add to the podcast? What were you thinking?
I think that's good. I think, thank you for listening if you made it this far.
Yeah, definitely. Well, and think we're, again, going back, we really want this space to be a space for men, and for, not saying women can't listen to our podcast, of course, but we're primarily trying to make it a space for guys to be able to ask questions. And if you guys have questions, comment them down below, or not down below, wherever you are, wherever you can comment them. We're here to help young guys, and help guys in general be able to talk about these issues, and that's our aim. And hopefully we can reach some people.
Thanks for joining us.
Here's just a tip. In this episode, we talked a little bit about our genitals and our expectations for sex. Did you know that 1 in 5 men between the ages of 18 and 59 experience premature ejaculation? Here's one strategy that you can use to help with premature ejaculation. It's called edging. I'm sure you've done this before, but here are the 4 steps to edging. Step 1, get aroused. Step 2, begin stimulating yourself, whether that's with your hand, a vibrator, or whatever method you prefer.
Step 3, right as you feel yourself getting close to coming, stop stimulating yourself and gently squeeze the head of your penis. This area is called the frenulum. It forms a small V on the underside of your penis near the head. Step 4, wait 30 seconds and begin stimulating yourself again. The purpose of this exercise is to train yourself to control when you orgasm, so it is important that you refrain from orgasming for at least 1 to 2 times through the steps. Feel free to look up edging method online for more information. Liking what you're hearing so far? Feel free to give us a follow at our socials down below and get some more info on sex therapy related topics.